Good day. My name is Imelda Williams. With this presentation, I'm going to give you feedback on the foot and toes practice bank that I gave you. And I'm just going to share my screen. The first case that I have is a patient with pain and swelling over the second and third metatarsal. I think for this image, we can maybe do some windowing. A little better. Let's just zoom in. Okay, so it should be quite obvious that there is a fluffiness, which is some callus formation around the second metatarsal, around the mid area. And if we look on the oblique view as well, on the third metatarsal, there's also some subtle fluffiness as well. And this is very typical of stress fractures. Also to note with this case, this is incidental, is that there is a hallux valgus of the big toe. Okay, so that is case 1. And then for case 2, get the big screen here. Okay, case 2 is a patient who had pain and swelling of the right foot, and it was over the cuboid after an injury. Okay, and I just wanted to put a bit of windowing. Okay, so if we look at the cuboid, we can see that there is a definite fracture of the cuboid, and it's on the lateral aspect of the cuboid. But if we also look at the navicular bone, the navicular talus joint doesn't look a bit compromised, but there's also a fracture of the navicular as well. So there's 2 fractures there of the tarsal bones. We have fractures of the cuboid and fractures of the navicular bone. And then moving on to case 3. And case 3 was a toddler who fell with an injury to the left foot. Always a little bit more tricky to look at pediatric images. Let's see if we can get this a little bit more clarity around that. Okay. I hope you are able to see this here. So there is a slight bump at the base of the first metatarsal, and that indicates that there is a buccal fracture at the base of the metatarsal. Moving on to case 4. And case 4 is a patient who was in a car accident and unable to wait there. There was only one single view that was available. So the very first thing that would, let me just make this a little bit lighter. So the first thing that catches one's eye is that there is some misalignment of the joints. You can notice here with the big toe, with the metatarsophalangeal joint, that there is subluxation there. But then also, if you look at the fifth metatarsal, that there is a subluxation. And the subluxation has occurred in the Lis flank joint, which is this joint. The other important thing to notice here is that there are also fractures, and there's multiple fractures of the cuneiform, and it also looks like there are fractures of the proximal metatarsals of the second and of the third metatarsal. And this is, of course, very typical of a Lis flank fracture dislocation. So very important that you view the alignment on this case. This is something that can be missed if you do not particularly look for alignment issues. There's an incidental finding here, and there's a calcification in the path of our osperonis brevis tendon, and this is known as an osperonium. So it's not an avulsion fracture, it's a normal variant. So multiple fractures as well as a dislocation of the Lis flank joint. Case 5. So case 5 has 2 images. And let's start off with the DP view. So for this patient, if we zoom in, it's a patient who had a previous injury and has pain over the metatarsal region. So what should really catch your eye is the head of the second metatarsal. It looks flattened. It's more sclerotic when you compare it, for example, to the third metatarsal. And the head has collapsed. And this is very typical of epiphyseal avascular necrosis. It's also named Freiberg's infraction. So let's just look at the other view as well. So this is the oblique view. It doesn't demonstrate it as well though as our DP view. But you can, when you look at the well-rounded metatarsal heads of the third, you can see that there is some flattening of the second metatarsal. So it is the DP view that actually shows us best the Freiberg's infarction. Okay, so these are all the cases that I gave you. So I trust that you've worked through it. So I will periodically post some cases for you before we get to our formative exam later on before you undertake your summative exam. If you've got any questions, please feel free to contact me. Thank you.